Hello there, friends. I hope you're having a peaceful and comfortable day. Today I want to talk to you about something many of us deal with as we get older. Joint pain. You know the feeling. Knees that creak when you get out of bed, stiff fingers in the morning, or aching hips after sitting too long. Sound familiar? Joint pain is something that can sneak up on us. One day you're gardening and the next day your back is aching. Or maybe you love walking but your knees start to complain after just a few steps. You're not alone. Millions of people over 60 feel the same way every day. But here's the good news. There's something simple, something your body might be crying out for, that could help ease the pain. And it's not some expensive pill or fancy gadget. It's a vitamin. Yes, just one vitamin that may already be sitting in your cabinet or can be added to your routine easily. Stick with me, because by the end of this video, you'll know exactly what this vitamin is, how it helps your joints, how much you need, and how to get it naturally. We're going to go step by step in simple terms to help you take control of that aching feeling and feel more comfortable in your own body again. Let's start by understanding why our joints start acting up in the first place. Now, before we talk about the vitamin, let's talk about why we get joint pain in the first place. What's going on in the body that causes our knees, shoulders, fingers, and back to hurt more as we age? Our joints are the places where two bones meet. They help us move, bend, twist, reach, lift, walk. Inside those joints, there's something called cartilage. It's a smooth, cushion-like material that keeps your bones from rubbing against each other. Think of it like a pillow between two hard surfaces. Now imagine if that pillow gets thinner, worn out, or even torn. That's what happens with osteoarthritis, the most common kind of arthritis in older adults. It's like the cartilage wears down over time, and without enough cushioning, the bones start to press together. That's what causes the pain, stiffness, and sometimes even swelling. And inside the joint, there's also something called synovial fluid. This is a slippery liquid that keeps the joint moving smoothly, like oil in a car engine. But as we age, we often produce less of this fluid, or it becomes thicker and less effective. So the joints start to feel stiff, like they need greasing. Add to that inflammation, which is the body's way of reacting to injury or irritation. And it's no wonder so many of us feel sore and stiff. The immune system sends out little messengers that cause swelling, warmth, and pain, even if there's no real injury. This inflammation can become chronic, meaning it just keeps going and going, especially in the joints. There are other reasons too. Carrying extra weight, old injuries, not moving enough, or even standing too much. But the big idea is this: as we get older, our joints become more fragile, more stressed, and more easily inflamed. And here's something you might not have heard before. Sometimes the problem isn't just wear and tear. It's a lack of the right nutrients, especially one very important vitamin. Let's talk about that in the next section. Now here's something most people don't realize. As we get older, our bodies don't absorb nutrients the way they used to. Even if you're eating pretty well, you might still be missing something important. And one of the most common things older adults are missing is vitamin D. Yes, and that's the vitamin your joints might be crying out for. Vitamin D isn't just about bones. It's also about joints, muscles, inflammation, and even your mood. But before we dive into the details of what it does, let's talk about why so many older adults don't have enough of it. First, our skin becomes less efficient at making vitamin D from sunlight as we age. When you're younger, just 10 to 15 minutes in the sun might give you a good amount. But after age 60, you can sit in the sun for the same amount of time and produce less than half the vitamin D you used to. It's like your body's natural vitamin D factory is slowing down. Second, a lot of us avoid the sun, maybe because of concerns about skin cancer or just not going outside as much. We stay indoors more or cover up when we go out. That means we're not getting enough natural sunlight to make the vitamin we need. Third, some medications, especially common ones like blood pressure pills, antacids, or cholesterol drugs, can make it harder for your body to absorb vitamin D from food or supplements. And finally, as we get older, our diets may change. Maybe we eat less or skip meals or stick to foods that are easy to digest. That's perfectly understandable, but it can also mean we're not getting enough vitamin D from what we eat. So even if you're doing everything right, you could still be running low on this key vitamin. And low vitamin D means more inflammation, weaker bones, weaker muscles, and yes, more joint pain. The good news? This is something you can fix, often with just small changes to your daily routine. But first, let's talk more about this amazing vitamin and why it matters so much for joint pain. Vitamin D might be the most important vitamin for your joints that you've never really thought about. A lot of people only think of it as the bone vitamin, but it's so much more than that. Let's keep it simple. Here's what vitamin D does in your body. It helps your body absorb calcium, which you need to keep your bones strong and prevent them from becoming brittle or breaking easily. It helps control inflammation, the kind that builds up in your joints and causes that aching, swollen feeling. It supports your immune system, so your body can fight off infections and heal from injuries. And it even helps keep your muscles strong, so you can move with less effort and stay steady on your feet. Now here's the amazing part. Studies show that people who are low in vitamin D are more likely to have joint pain, especially in the knees, hips, and back. Some research even shows that adding more vitamin D can reduce joint pain in just a few weeks, especially if your levels were very low to begin with. Imagine that. Something as simple as a vitamin could make your joints feel less stiff, less sore, and more mobile. And maybe even help you get back to doing things you love, like walking in the park, gardening, or dancing. So now the question is, how much do you need, and how can you get it? Alright, let's talk numbers, but I will keep it simple and make it easy to picture. Most health experts recommend that older adults get at least 800 IU of vitamin D per day. IU stands for International Units, which is just a way of measuring vitamins. In micrograms, that's 20 micrograms per day. But here's the thing. Depending on your health, where you live, and how much sunlight you get, some people may need 1,000 to 2,000 IU per day to feel their best. Now you might be wondering, what does 800 IU actually look like? Let's break it down with real-life examples. 3 ounces of cooked salmon, about the size of a deck of cards, gives you around 570 IU. That's most of your daily dose. 1 tablespoon of cod liver oil gives you over 1,300 IU. More than enough in just 1 spoon. 2 cups of fortified milk, the kind with added vitamin D, gives you about 200 IU total. 1 egg yolk has about 40 IU. Not much, but every little bit helps. A small can of tuna gives you about 150 IU, roughly equal to 2 or 3 slices of tuna on toast. So to reach 800 IU a day through food alone, you'd need something like a serving of salmon, a glass of fortified milk, and maybe an egg. That's possible, but not always easy, especially if you don't eat much fish or dairy. And here's another important thing. Sunlight can help your body make its own vitamin D. Just 10 to 20 minutes of sun exposure on your arms and face a few times a week can make a big difference, if your body still makes enough. But remember, as we age, our skin doesn't produce as much. If you're over 65, you might make less than half the amount a younger person does. Plus, if you live in a cloudy area, or it's winter, or you always wear sunscreen or long sleeves, you might not be getting much at all from the sun. So many older adults choose to take a supplement to help meet their daily needs. Supplements come in different forms: soft gels, tablets, liquids, and they're usually affordable. Most common doses are 1,000 IU per pill, which is safe for most people. But here's something to know. There are 2 types of vitamin D in supplements, D2 and D3. The one you want is D3. That's the kind your body absorbs better and uses more efficiently. D2 is still helpful, but D3 is usually the better choice, especially for joint and bone health. Also, if you're already taking a multivitamin, check the label. It might already include some vitamin D, but it's often a small amount, like 400 IU, which may not be enough by itself. You can always ask your doctor for a vitamin D blood test to see where your levels are. That way you'll know if you're low and how much you should take. But if you don't want to do a blood test, starting with 800 to 1,000 IU daily is usually a safe and helpful amount for older adults. And remember, this isn't about taking a magic pill, it's about giving your body what it's missing. Vitamin D works with time, usually over days or weeks, and it's often the first step toward less joint pain and better movement. Now let's talk about what happens if your body doesn't get enough of it. Let's take a moment to imagine your body running low on vitamin D. Not just for a few days, but for weeks, months, even years. What does that actually do to you? The first thing many people notice is feeling tired. Not just I need a nap, tired, but that deep, dragging kind of tired where even simple things like walking to the mailbox or doing the dishes feel like a chore. That's one of the early signs of low vitamin D. Then comes muscle weakness. You might feel like your legs don't have the strength they used to. Climbing stairs feels harder. Getting up from a chair takes more effort, and carrying groceries becomes more challenging. That's because vitamin D helps your muscles work properly, especially the large ones in your legs and back. Now here's the big one: bone and joint pain. When your body doesn't have enough vitamin D, it struggles to absorb calcium, the mineral that keeps your bones strong. Without enough calcium, your bones can start to thin out, leading to osteoporosis. That's when bones become fragile and easier to break. But even before that happens, you can feel pain. Dull, aching pain in your lower back, hips, shoulders, or knees. Some people say it feels like their bones hurt. Others just notice that their joints feel more sore than usual, even after a good night's sleep. In fact, many older adults who feel stiff all the time, or who wake up feeling like their body is rusted, might actually be low in vitamin D, and just don't know it yet. Let me give you a real-world example. Imagine your joints are like the hinges on a door. When there's not enough vitamin D, it's like forgetting to oil those hinges. The door still works, but it squeaks, sticks, and wears down faster. Add some oil, or in this case, vitamin D, and suddenly the movement becomes smoother and quieter. And it's not just joints. A lack of vitamin D can also cause bone pain, especially in the legs or ribs. Some people even confuse it with other conditions like fibromyalgia or arthritis, because the discomfort can be widespread. If the deficiency goes on for a long time, it can even affect your posture and make bones more likely to break, especially in the spine or hips. That's one reason why falls are such a serious risk for older adults. Brittle bones and weak muscles are a dangerous combination. Now here's something interesting. Studies have found that people who live in sunny places like Florida or California can still be vitamin D deficient. Why? Because they're staying indoors more, covering up with clothes, or using sunscreen, all of which block the sun's rays from helping your body make vitamin D. So it's not just about where you live. It's about what your body has access to and how well it's using it. The bottom line is this: not getting enough vitamin D slowly wears down your joints, weakens your muscles, and makes everyday life more painful than it needs to be. The good news? It's often easy to turn things around, and you don't have to wait forever to feel better. Let's move on to how you can start adding more vitamin D into your life, safely and naturally. Now that we know how important vitamin D is, especially for joint pain and mobility, let's talk about how you can get more of it, safely and simply. There are three main ways: sunlight, food, and supplements. Let's go through each one. 1. Sunlight, your natural source. Your skin makes vitamin D when it's exposed to sunlight. It's actually the most natural way for your body to get it. But remember, as we age, our skin becomes less efficient at making vitamin D. That means we may need more time in the sun than we did when we were younger. So how much sun should you get? Experts recommend about 15 to 30 minutes of sun exposure on your face, arms, and legs, at least 2 to 3 times a week. No sunscreen during that time, and ideally between 10 a.m. and 2 p.m. when the sun is strongest. But here's the catch. Many older adults either don't go out much, or they wear clothing that covers most of their skin. And in the winter or in places that don't get much sun, it's hard to rely on sunlight alone. So while sunlight helps, it's often not enough by itself, especially for seniors. That's where food and supplements come in. 2. Food. Eat for your joints. You can also get vitamin D from what you eat, especially from fatty fish, fortified foods, and certain oils. Here are some good choices. Salmon, cooked, 3 ounces gives you around 570 IU. That's almost your full daily amount in one meal. Tuna, canned in oil, a small can gives about 150 IU. Sardines canned, 2 sardines have around 45 IU. Egg yolks, 1 egg yolk has about 40 IU. Cod liver oil, just 1 tablespoon gives you 1,360 IU, more than you need in one day. Fortified milk, 1 cup gives you about 100 IU. Fortified orange juice, 1 cup gives about 100 IU. Fortified cereals. Some brands offer around 80 to 100 IU per serving. Now, if you're not a fan of fish or don't drink milk, it might be hard to get enough vitamin D through food. You'd need to eat salmon or tuna nearly every day to get there, and not everyone likes or tolerates fish. So for many people, especially seniors, the easiest way to make sure you're getting enough is through supplements. 3. Supplements. Simple and effective supplements are easy, affordable, and safe. And for many people, they're the best way to get the right amount of vitamin D every day. Most older adults can benefit from 1,000 IU to 2,000 IU per day. This is usually enough to bring up your levels slowly over time without going too high. Here's how to take them. Choose a vitamin D3 supplement. It's better absorbed than D2. Take it with food, especially something with a little fat, that helps your body absorb it better. Be consistent. Take it every day around the same time. You can find vitamin D3 in soft gels, tablets, drops, or chewables. Some seniors prefer liquid drops, especially if swallowing pills is hard. Others like combining vitamin D with calcium, which is also important for bone strength. One common product is a tiny softgel that contains 1,000 IU of vitamin D3, about the size of a green pea. It's easy to take and usually costs just a few cents per day. Some multivitamins include vitamin D, but usually only around 400 IU. That's not enough for most older adults, especially if you have joint pain or low levels. And one last tip. If you're taking a high dose, like over 4,000 IU per day, you should talk to your doctor first. Too much vitamin D can cause problems over time, like high calcium levels in the blood. But for most people, 1,000 to 2,000 IU daily is very safe. Now let's talk about how long it takes to feel better, and what changes you might start to notice once your body starts getting enough. You might be wondering, if I start taking vitamin D today, when will my joints stop hurting? When will I feel better? The answer is, it depends. But the good news is many people start noticing improvements within a few weeks. Here's what typically happens. In the first week or two, you might begin to feel a little more energy. That tired, heavy feeling may start to lift. After about 3 to 4 weeks, muscle strength can improve. You might find it easier to stand up from a chair or climb stairs. Between 4 and 8 weeks, joint pain often starts to ease. The swelling and stiffness may reduce, making movement less painful. Over 2 to 3 months, many people report feeling much more mobile and active. Tasks like walking, gardening, or even light exercise become easier and more enjoyable. Keep in mind, these changes are gradual. Vitamin D works best when combined with other healthy habits, like gentle exercise, a balanced diet, and good hydration. Also, if your vitamin D levels were very low to begin with, it might take a bit longer to see a big difference. But don't get discouraged. Your body needs time to rebuild strength and heal. If your joint pain is severe or doesn't improve after a few months, be sure to check with your doctor. Sometimes joint pain can come from other issues like arthritis or injuries, and they might recommend additional treatments. But for many older adults, simply correcting vitamin D levels can be a game changer. Remember, this vitamin helps your body heal from the inside out, making your joints less inflamed, your muscles stronger, and your bones healthier. That's why many seniors say it feels like a miracle when they start taking vitamin D regularly. So you've started taking vitamin D, and maybe you're already feeling better. That's wonderful. But to keep your joints happy and healthy, there are a few more things you can do every day. Here are some simple tips to support your joint health along with vitamin D. 1. Stay active. Movement is medicine for your joints. It helps keep the cartilage, that smooth cushion between your bones, healthy and flexible. Try to do gentle exercises every day like walking, swimming, or stretching. Even 20 to 30 minutes a day can make a big difference. Remember, it's not about pushing yourself hard. It's about staying consistent and moving in ways that feel good. 2. Maintain a healthy weight. Carrying extra weight puts more pressure on your joints, especially your knees, hips, and lower back. If you're overweight, even losing a few pounds can reduce joint pain and improve mobility. Focus on healthy eating and regular activity. Your joints will thank you. 3. Eat anti-inflammatory foods. Some foods help reduce inflammation in your body, which can ease joint pain. Include plenty of fruits and vegetables, especially berries, leafy greens, and citrus fruits. Healthy fats, like those found in olive oil, nuts, and fatty fish such as salmon. Whole grains instead of processed grains. Spices like turmeric and ginger, which have natural anti-inflammatory properties. 4. Stay hydrated drinking. Enough water helps keep the cartilage in your joints lubricated. Aim for about 8 glasses of water a day, more if you're active or it's hot outside. 5. Avoid smoking and limit alcohol. Smoking damages your bones and can increase inflammation, making joint pain worse. Alcohol in moderation is usually okay, but heavy drinking can harm your bones and muscles. 6. Consider other supplements if needed. Sometimes your doctor might recommend additional supplements like calcium, magnesium, or omega-3 fatty acids to support joint health. Always talk with your healthcare provider before adding new supplements. 7. Listen to your body. If your joints feel sore or tired, take a break and rest. Don't ignore persistent pain. If something doesn't feel right, check in with your doctor. By combining vitamin D with these healthy habits, you're giving your joints the best chance to stay strong and pain-free. Next, I'll cover some common questions about vitamin D and joint pain that many seniors ask. Now, I want to answer some of the most common questions that seniors have about vitamin D and joint pain. These are questions I get all the time, so hopefully they'll help clear up any doubts you might have. Question 1. Can I get too much vitamin D? Yes, it is possible to get too much, but it's rare. Taking more than 4,000 IU per day over a long time can lead to too much calcium in your blood, which might cause nausea, weakness, or kidney problems. That's why it's important to stick to the recommended dose, usually between 800 and 2,000 IU daily, unless your doctor advises otherwise. Question 2. Can vitamin D cure arthritis? Vitamin D isn't a cure for arthritis, but it can help reduce inflammation and support joint health, which may relieve some pain and stiffness. If you have arthritis, taking vitamin D along with your doctor's treatment plan might improve your symptoms. Question 3. How do I know if I'm low in vitamin D? Common signs include fatigue, muscle weakness, bone or joint pain, and frequent falls. But the only way to be sure is with a simple blood test. You can ask your doctor for this test during your next visit. Question 4. Can I get enough vitamin D from sunlight alone? For many seniors, sunlight isn't enough because skin makes less vitamin D with age, and factors like sunscreen, clothing, and limited outdoor time reduce sun exposure. That's why food and supplements are important. Question 5. Are there any side effects of taking vitamin D supplements? Most people don't experience side effects when taking recommended doses. If you take very high doses for a long time, you might experience nausea, vomiting, weakness, or kidney problems. Always follow the dosage instructions on your supplement or your doctor's advice. Question 6. Can vitamin D help with other health issues? Yes. Vitamin D plays a role in immune health, mood, heart health, and even brain function. Many seniors find that maintaining good vitamin D levels improves overall well-being, not just joint pain. If you have other questions, feel free to write them down and talk to your healthcare provider. They can give you advice tailored just for you. Thank you for sticking with me through this video. I know joint pain can be tough to live with, and sometimes it feels like nothing helps. But remember, your joints are crying for vitamin D, and often just adding the right amount to your daily routine can bring real relief. Vitamin D isn't a magic pill, but it is a powerful tool. It helps your body heal, strengthens your muscles, and supports your bones. And that means less pain, better movement, and a more active life. Here's what I want you to take away today. Spend a little time in the sun when you can. Include vitamin D-rich foods in your diet. Consider a vitamin D3 supplement if you're not getting enough. Pair vitamin D with gentle movement and healthy habits. And most importantly, be patient with yourself. Changes take time. If you ever feel unsure about your vitamin D needs or your joint health, talk to your doctor. They can test your levels and help design a plan just for you. Your body has amazing power to heal. Sometimes it just needs a little help, and vitamin D might be exactly what your joints have been waiting for. Thank you for watching. Take care of yourself, and here's to stronger, happier joints.